it really encourages discussion on the role of the doctor. And this discussion will never ever happen if assisted suicide is still illegal, right? No patient will ever talk about assisted suicide if they're under the stigma of requesting an illegal form of treatment, or at least very few of them. So we are empowering these people to become more vocal about what makes them choose assisted suicide, something that I don't think the opposition has ever grappled with. We need to talk about the limits of the doctor, just like Sanjiv talked about. I can see my fellow doctors that palliative care and medicine in general has progressed, but there are limits to what I can do. There are limits to what we can achieve. There are some diseases I cannot cure. There is pain, bone cancer, that no matter how much morphine I administer, I cannot relieve. And there is pain and suffering I'll never be able to comprehend. And when assisted suicide is legalized, doctors can begin to understand what they can or cannot do when they hand power over to their patients to choose when and where they want to die. The second way it encourages discussion. Go.
So why are you talking about limitations of doctors when you are essentially overcoming the limitations at the end of the day by allowing the doctors to allow the patients to die?
No, I'm not overcoming their limitations. If the doctor decides that his limitation is a religious conviction, he can perfectly well opt out of this system and get another physician to help in this procedure. All we are doing is giving the patient the choice to choose, as we have been saying for a long time. But my second point of how it encourages discussion is how it encourages discussion between religious conservatives and the non-religious. Too many times people who are dying have been tainted by this whole thing about you've got to die, so you've got to prepare to meet your maker and stuff like that. Oftentimes, this discussion is so terribly polarized, with both sides holding on to their arguments. When assisted suicide is legalized, it forces people to think about what the end of life is all about. People start to decide. Say, a religious person suddenly chooses to have assisted suicide. A non-religious person chooses to honor the sanctity of life like a religious person might. And this encourages the discussion on what life really means in society and what patients can or cannot choose. This discussion would never have existed if we never legalized assisted suicide. And for all these reasons, for how we allow patients to choose and how we allow patients to die a dignified death, we are very, very proud to propose.
Okay.